Ladies and gentlemen, today I would like to present to you the 20-year journey to protect asthma and COPD patients in Vietnam. I am Dr. Lan from the University Medical Center Ho Chi Minh City, Vietnam. I am also the chairwoman of the Ho Chi Minh City Society of Asthma, Allergy, and Clinical Immunology. First, we will have some congratulations from professors around the world. We will have the letter from the Professor Claude L'Enfant and Professor Susan Her. Professor Claude L'Enfant, all of us have known that he is Executive Director of the Global Initiative GO and GINA. And Professor Susan Her, Scientific Secretary of GO and GINA. They are our mentors. I am very grateful for their teaching. And then we will have the letter of congratulations from World Health Organization, from Dr. Cherian Varghese, who is at that time the leading of the Department of Non-Communicable Disease in World Health Organization in Geneva. And then we also have the letter from the Professor Jean Bousquet, who is the inventor of ARIA and GER. ARIA, it means that allergic rhinitis and its impact on asthma. It is a very important document for the asthmatic patients and also for allergic rhinitis. And GER means that Global Alliance Against Chronic Respiratory Disease. The last one will be the letter from the Professor Azu Yogang Siklu. She is the GER Vice Chair. And now I would like to present to you step-by-step 20 years of asthma COPD outpatient care unit with the acronym as ACOCU. This is the journey to protect asthma and COPD patients in Vietnam. The first thing I would like to present to you is how to build and develop the ACOCU network in Vietnam. You have seen our country is very long, 1,700 kilometers from north to south. I would like to talk about the situation of asthma COPD management in the year of 2000. At that time, there is no management of asthma COPD outpatient care. It means that we have waited until they have an exacerbation and then treated them only at that time. So all of us know that the burden of the exacerbation are very high and even high mortality. So the problem is that how we can take care of those asthmatic and COPD patients in their stable status to prevent exacerbation. In the year of 2000, I have received the fellowship of the American Association for Respiratory Care. I have learned a lot from them, especially the care of the outpatient. When I returned to the University Medical Center, Professor Nguyễn Đình Hối has appointed me to the position of Head of Respiratory Functional Exploration, Department of University Medical Center, Ho Chi Minh City, Vietnam. From this department, I built up one first ACOCU, Asthma COPD Outpatient Care Unit. What are the basic components of an ACOCU? The ACOCU have to work adhering to the GINA and GO and ARIA, and especially important is using the spirometry. In low and middle income country, the chest X-ray is very important because the prevalence of tuberculosis is very high. And we have to distinguish between those diseases. A spirometer, it is the main component of an ACOCU. Without spirometer, there could not be an ACOCU. Because it is very, very important to have one spirometer. It helps us to make accurate diagnosis. It is the first and very, very important, the crucial step for every doctor is making a right diagnosis. And we have learned that after 20 years, we have seen that with one doctor, one patient with dyspnea coming with us, we have 27 causes of dyspnea. And the spirometric test will help us in initial phase to make a diagnosis. Smoking cessation is very important. And we have an electronic medical record with software. We have also patient club and the free hotline for asthma and COPD patients to help them assist, especially important in the exacerbation. And at the first time, I built up this ACOCU in Ho Chi Minh City. And I do not have any intention to extend it. But there is one day I always remember of that as a decision day. And that day there is one patient, asthmatic patient from Ha Giang province in the northern part, and two patients from Cà Mau province. Three of them come to Ho Chi Minh City to get help for their asthmatic and COPD diseases. Since that day, I think that I have to build up ACOCU or in all provinces of Vietnam, 63 provinces. So I conduct one workshop. This is the first workshop to multiply the ACOCU model. And after 5 years, it is our group of ACOCU. We have worked together to multiply the ACOCU. But the important thing is that we have to make policy advocacy, because there are many things to get. First of all, is there must be a CME training for doctors. It must be compensatory. In other way, doctors will not learn about new ways of treatment COPD and asthmatic patients, especially outpatient care, because they usually take care of those patients in exacerbation, so that outpatient care is the new things of GINA and GO and ARIA and spirometer that they have to learn. And also we have a campaign to have a health insurance cover for inhaled corticosteroid. At that time, just for inpatients at first. And we also were at that time against the SABA short-acting beta-2 agonist abuse. And on the year of 2005, we urged health insurance to pay inhaled corticosteroid for outpatient. This is the next step, outpatient. And on the year of 2011, we make a campaign to persuade health insurance to cover the cost of spirometer for asthma and COPD patients. All of that we have done with the help of reporter Lê Thanh Hà. It is in the newspaper, famous newspaper in Vietnam. And we have also done a study for comparison of two ways of asthma treatment. And we have shown clearly that if we treat those patients in the stable status, in comparison with the cost in treating exacerbation only, it is about $200 and it is about 2,000 US dollar. It means that we can save 19% of the cost if we treat asthmatic patient in their stable status instead of waiting for the exacerbation only. We also done the comparison of two ways of COPD treatment, and also for the comparison with the treatment in the stable status with the exacerbation, we have the same result, about $1,000 per year if we treat one outpatient COPD patient. and compare with 10,000 US dollar if we treat them only in exacerbation. So it has the same result. We can save 90% of the cost if we treat COPD patient in their stable status instead of treating only at the exacerbations. With this beautiful result, we using the scientific data, but the next step is down to the district level. It is not easy to persuade insurance company to pay for district hospital in take caring of the those patients asthma COPD. So we have to do one scientific research of the Department of Science and in Ho Chi Minh City in 2 years. And we have done one public health action publication in the paper of the union about the implementation of GINA guideline in Ho Chi Minh City, a model of Vietnam. And then we organized a conference with the officer from the insurance company of the government to persuade them to permit to establish the ACOCU district at Ho Chi Minh City. And the result is very, very good. You could see that the number of the outpatient of asthma and COPD increase. And then the number of the asthmatic patient increase. And they also visit again and again. And the number of the patient, of severe patient who require hospitalization or refer to tertiary decrease. It's the same result of COPD patient. The death and the referral to the tertiary hospital decrease remarkably in comparison with those patients who take care in stable status as outpatient. But the most difficult part is how can we provide care to the community, to the primary care in the rural area where the circulation is very difficult. There is no doctors, there is no medication, there is no spirometer. And at that year, in the year of 2010, the regional WHO have come to Vietnam, and we have done a study on the non-communicable chronic disease management at primary care. The results are very, very good, but at that time, our government still do not recognize the importance of non-communicable disease at primary care. But we still keep the results of this study. And the next step is we establish a CHAC International Clinic under the Community Health Development Institute of the academician Dương Quang Trung in 2010. It's a private one. We use a simple questionnaire for screening and asthma COPD. It is a 2 thesis, master 2 thesis for the 8 simple questions for screening asthma and 5 simple questions for COPD. And we work with family doctors to e-mentor for primary care doctors. So with this distance learning, we can get to the doctors who live in far, far Vietnam. The second is all thing that we have done to build up the ACOCU in the province and then to the district, and then how to get to primary care in the rural area. The second part of our work is raising awareness of asthma and COPD. To do it effectively, we have to establish the professional societies. We have established the first Ho Chi Minh City Respiratory Society on the year of 2010, and then 7 years later, when the Respiratory Society is strong enough, we build up the Society of Asthma and Allergy and Clinical Immunology. And then At the same year, we helped to form the Vietnam Respiratory Society. It is a very, very important step. We have annual scientific conference of respiratory societies in each year, and every year now we have about at least 5 annual scientific conferences. And in the year up to 2019, it is the first Asia Pacific Respiratory Society Conference organized in Vietnam, joined with our Vietnam Respiratory Society. It is a very important step. And I come to Professor Fukuchi. He is the founder of Asia Pacific Respiratory Society, to report that I have completed the professor's assignment after 10 years. It means that he has required that have a Vietnam Respiratory Society join in the Asia Pacific Respiratory. I have fulfilled this promise after 10 years. And very important thing is that the MOH have agreed that all of our doctors and nurses must have at least 24 hours of continuous medical education with certificate each year to get the license to work. So thanks of that, we have organized many asthma COPD management workshop in the community. Asthma COPD patients club is very important. They will increase the adherence after the meeting. The raising public awareness, I use all kinds of day to increase the public awareness. The Asthma Day with more than 1,000 participants, the COPD Day, the World Tobacco Day, the World Spirometry Day. And there is another one that I will develop in the next years. The third part is international cooperations. In the year of 2010, with the presence of the Minister of Health, Professor Clermont, Professor Susan Hara, Dr. Olivier, the representative of WHO in Vietnam. We have met with all of them to talk about the girl, but in fact, it is not moving very well with the MOH or the WHO. I just do it just as an individual effort up to now. And we have also brought Professor Clermont and Professor Susan Hera out to the Department of Medicine, Ho Chi Minh City, go to the University Medical Center, and our doctor attended the M Health of WHO in Norway. In the 2008 WHO country, WHO and Vietnam coordinate a practical spirometry course with the attendant with Professor Camo Thuam and the registered respiratory therapist Susan Blanchard of American Association of Respiratory Care. We have a spirometric workshop, a whole country. And as I have mentioned, in the year of 2010, the WHO of Western Pacific have conducted with us a very successful study of the application of NCD program of WHO in primary care in Ho Chi Minh City. I hope that this program will be continued. We also have the GNA Assembly member and Go National Leader joining also with the International Primary Care Respiratory Group. And I hope that we will extend those cooperation with GAP, with FRA, with ALAT, with ERS, with AGS, etc. And from our experience, we have organized a healthy land program for the region, with 6 Asian countries participated: Vietnam, India, Indonesia, Malaysia, Philippines, Singapore, Korea, Taiwan, and Thailand. And we have 3 healthy land summits in 2018 and 19, 20. For the cooperation in Vietnam, we have joined the COPD expert panel to prepare for the national guidance of COPD treatment. It's very, very important. And also for the asthma and COPD guideline. And at that time, the Minister of Health has published the guidance for asthma and the guidance for COPD. The important thing is that we must have the national guideline from MOH to get the reimbursement from the insurance company. Without the national guideline issued by Minister of Health, we could not get the insurance. And 5 years after the first ACOCU, the Vietnam Lung Association joined with us with the study of COPD prevalence in Vietnam. And only 10 years of my first ACOCU, we get the National Asthma and COPD Prevention Program. It is a national one. 10 years. And I also try to build up the ACOCU asthma COPD outpatient care unit for military hospitals, because it is very hard for us to get the frontiers, far away, isolate everything. And we need the military hospital to help us in those difficult regions. And there is a memorandum of understanding for healthy land program between the Medical Service Administration of Minister of Health and AstraZeneca. It is a very important program with this fund of $1 million US. And it is still working until now. And also there is a Healthy Land website launching from the MOH with our participation. This is the fan page of MOH for Healthy Land. And the second memorandum is also between the Service of Administration of MOH and AstraZeneca to extend not only asthma, COPD, but extend to the lung cancer. So what are our achievements? Up to now, we have built up 235 ACOCUs after 20 years. It covers 53 over 64 provinces. There is some region of mountainous in frontiers. It's very hard. It's a mountain, rocky mountain there. And we have to ask the help of military hospital and some poor province in high region, high mountain. We will have to cover all of them. And there is just 72 of district hospital, over more than 700 district hospitals. So we just have done just about 1/10 of the needed ACOCU. But the interesting thing is that you have seen that there is the participation of hospital and private hospital and clinics. It means that ACOCU is very effective to attract the private sector to join with us. And we have organized ACOCU in 4 military hospitals. And we also support for the ACOCU building up. We will give the training, spirometric training, the screening, chest X-ray, spirometric done, medical examination, donation of spirometry spectrometer for each ACOCU. Asthma COPD outpatient club raising, and we also give and guide how to use the software to keep the medical records. And it is two IT engineer, informatic engineers of our ACOCU team. It is the conditions to have an ACOCU. If any hospital would like to have an ACOCU build-up, they have to fulfill all of these requests and commitments to make sure that an ACOCU will be sustainable. And the benefits of building and up an ACOCU, as you have seen, they will receive a lot. The most important achievement, what are they? The most important thing after 20 years is now asthma and COPD outpatient care in Vietnam are well managed at ACOCU, adhering to the updated national guidelines. The second important thing is a health insurance pay for the asthma, COPD medicine and pulmonary function tests. It's very, very important because the adherence of those chronic patients will increase remarkably with the payment from the health insurance. We have already national strategy for the prevention and control of non-communicable disease for period from 2015 to 2025. And we hope that the WHO and other professional societies will help us to implement this strategy. But the important thing is that we have already the national strategy. Many organizations have contributed to the development of ACOCU network. I are sincerely thankful all of them. But the ACOCU network also have other funds from national budget, from international funds in public hospital and military hospital, private hospital, build up ACOCU with their own budget. And we have also the successfully treated patient. They are come back and give us funding to build up another ACOCU. The result is that we have improved the quality of life of our asthma and COPD patients. They are our COPD patients. Celebrate the COPD day. And we have the asthmatic patients. She has a successful run 10 kilometers in Ho Chi Minh City. And she is the symbol. And now they are actively joined with us in increasing the awareness of COPD and asthma. And we do not stop on the simple ACOCU. We have organized advanced ACOCU in the clinic number 1 of University Medical Center, Ho Chi Minh City, Vietnam. It is the launching ceremony. In advanced ACOCU, we have a spectrometer, of course, it is the first one. And we go to the FENO, it is a rather simple one. We go to implant oscillometry. It's very, very important for those elderly patients who could not perform spirometry, and for the pediatric patient under 5 years who could not perform spirometry. And we have the very advanced one. It is cardiopulmonary exercise testing. It is the first CPAP in Vietnam organized by our ACOCU. And we have also sleep apnea, that polysomnography is now a problem in Vietnam. There are the asthma COPD publication of doctors and also from patients. Scientific researches and post-graduate resuscitation is many, because we are plenty of data. And we also would like to have the international cooperation in using all of those data, because up to now we have only in the first UMC, we have more than 120,000 outpatient medical records of asthma and COPD. So what are our plans for ACOCU network development? We continue to train for doctors and nurses about asthma, COPD, allergic rhinitis, for pulmonary function testing, basic and advanced, teach them how to make their scientific research and publishing. We continue to build up ACOCU in whole Vietnam, down to district hospital. There are many things to do. Establish a referral and back referral system between primary care, help us with district hospital in non-communicable disease. There must be a cooperation between those district hospital and primary care. Monitoring and upgrading existing ACOCU. ACOCU quality assurance by Minister of Health, annual inspection. Scientific research and international publishing, application information technology in ACOCU, and strengthening asthma COPD patients. Advocacy for policies. We have still advocate for a decision from MOH that ACOCU must be built up in all public hospitals down to district hospital. Ensure the quality of asthma medication in insurance list of all hospitals. Smoking cessation, reduce air pollution, reduce obesity, and regularly update our national asthma guideline. We will increase the international cooperation. We expand ACOCU to NACOCU, non-communicable disease plus ACOCU, as a doctor from WHO as a consultant chariot. Implementation of PAC in Vietnam for primary care. It is all of our effort in 20 years, from the 2000 and 2020, but we still continue and we look forward for cooperation with all organizations, with all individuals for a better birth of Vietnam. And we also would like to expand our work to those poor countries in this region, such as Cambodia, Laos, and Myanmar. Thank you so much for your listening.